Today, we will be focused on the Ebola virus disease. I'm going to be giving you an overview of the disease and how to diagnose it, as well as how to manage it clinically. My name is Dr. Esther Tan. I am the Senior Medical Officer, as well as Head of Public Health Section within the United Nations Division of Healthcare Management and Occupational Safety and Health. So first of all, just to share with you that a lot of the information that I'll be presenting is actually found in WHO documents, which are here, so you can go back to look at it anytime. I will be focusing on introducing the disease to you, sharing with you helpful UN resources, looking at the clinical and laboratory diagnosis of the disease, contact management, which is super important, as well as clinical management. So Ebola virus disease really first appeared in 1976 in South Sudan and the DRC. And in the DRC outbreak, it occurred near a village near the Ebola River, and that's where it got its name from. The Ebola virus is actually one of 3 genus that belongs to the virus family called Filoviridia. And within the genus of Ebola virus, there are actually 6 different species. And you would have heard of Zaire species, which affected West Africa in 2014. And then now we have the Sudan species that's occurring in Uganda. The 2014 to 2016 outbreak in West Africa was really the largest outbreak of Ebola. So the Ebola virus disease was previously known as Ebola hemorrhagic fever, but now it's been changed to Ebola virus disease by the WHO. And the natural host of the virus is fruit bats. It is a disease that is quite rare, but then when it occurs, it is severe and can be fatal in humans. The disease is transmitted from wild animals and then spread into the population through human-to-human transmission. Typically, the case fatality rate, and that means the number of deaths over the number of cases infected, is usually around half, 50%. It ranges between 25 to 90%. In the current outbreak in Uganda, it's about 28, 29%. Obviously, as you probably are aware, community engagement is really key to controlling this outbreak. And things like case management, infection prevention and control practices, surveillance, contact tracing, good laboratory services, safe and dignified burials, and community mobilization and health awareness. All this is really important when we need to control this outbreak. In terms of the current outbreak in Uganda, on 20th September, health authorities declared this outbreak caused by the Sudan strain. And as of today, which is 2nd of November, at the time of this presentation, there were 129 cases, 37 deaths, which translates to a case fatality rate of 28%. And this is not the first time that the Sudan strain has caused an outbreak. Previously, we have had 7 previous outbreaks reported already, 4 of which occurred in Uganda and 3 in Sudan. Currently, this strain has no approved vaccine, unfortunately. Vaccine has only been approved against the Zaire strain. However, there are some candidate experimental vaccines that are being trialed for this particular strain. So we'll see if any new candidates come up and be shown to be effective against the Sudan strain. But right now, there is no approved vaccine. I just want to share with you some helpful UN resources. So the first is we have this UN Medical Director's Ebola Risk Mitigation Plan, and both English and French are available. I put the links there that you can access. And this is a really helpful document that really outlines for you some of the key actions that should be taken by different categories of staff. For example, UN people who are traveling, UN personnel who might be cleaning a health facility, healthcare workers, laboratory technicians. So all these different categories have different precautionary measures that they should take, and this document spells it out. Another document that we have that's really helpful is basically a checklist for UN health facilities that are in high-risk locations. And so I would actually encourage all of you who are healthcare workers working in your medical service to actually take out this checklist and run through it with your service to make sure that all elements are covered and you're prepared for an outbreak if it occurs. Something else that we had sent out to all missions last year was the need for everyone to make sure that they have enough PPE stock on hand, as well as how to calculate the quantities needed. So we have given to everybody this PPE calculator that's from CDC, and it will tell you, what is the individual types of equipment and pieces that you need per patient that you're expecting to see. If you need a training video on how to use the calculator, you can watch this video here. WHO has also a lot of courses specifically for Ebola, first responders, healthcare workers that are responding to Ebola patients. So you can review these courses as well and register for it and make sure that you take it. So now I'm going to move on to diagnosis, both in terms of clinical as well as laboratory diagnosis. In terms of the signs and symptoms of EVD, it can come on very suddenly in the beginning. It can be just dry symptoms, and they include things like fever, fatigue, muscle pain, headache, sore throat. But then after a few days, this can move on to the wet symptoms like vomiting, diarrhea, rash, bleeding, and you can get also problems with your kidney and liver function. You may also have low white blood cells and platelet counts in such patients and high liver enzymes. How does the disease actually progress? So in terms of the beginning, you get exposed, and then there is an incubation period. So after you get exposed, you may be incubating the virus, and this is a period when you have no symptoms and you're not contagious either. This incubation period is between 2 days to 21 days. And then when you start having symptoms, that's when you start to be contagious. After day 3 or day 4, these symptoms may become wet symptoms, like what I said before with the vomiting and diarrhea and bleeding. And then day 7 or day 10, death can occur. And that's also when the amount of virus in your body is the highest then. And that's why we need to pay attention to how you manage the body of a dead person with Ebola, and as well as having safe burial practices. In terms of case definition, when do you think you might have a suspect case? Basically, if you see these signs and symptoms that I talked about, and you also have some kind of risk factor where the person was exposed to the blood or body fluids of the infected person, or they were exposed to fluids from an animal, for example, that was infected. So all of these are potential risk factors for exposure. So if you have signs and symptoms and you have these risk factors of exposure, then you have a suspect case on hand. For what's considered a lab confirmed case, obviously, if there is a lab confirmed diagnosis and a positive result of Ebola virus. Here are some posters that you can get for signs and symptoms of Ebola, and you should definitely spread awareness to staff so that they know what to do when they see any of these symptoms, that they should go and visit and call their health facility immediately. Other considerations for clinical diagnosis, many times the signs and symptoms is very similar to other infectious disease like malaria, typhoid fever, meningitis, or even pregnancy. Just to be aware that sometimes these things can also have co-infections with Ebola as well, so that you could have both malaria and Ebola at the same time. And just to note that pregnant women should really be tested early and rapidly if Ebola is suspected. In terms of lab diagnosis, I just wanted to make a note here that the virus can only be detected in the blood only after symptoms come on, especially after fever. However, it may take even a few days after symptoms begin for the virus to reach a level where the lab test can pick it up. As such, it is best to use the PCR test because PCR test is very, very sensitive and that they can detect very low levels of Ebola virus. And in fact, WHO recommends that the PCR test be used as a gold standard for confirming Ebola disease. And what do you do if you have test negative cases, but they're also suspected cases? So as I mentioned in the beginning, sometimes you can be test negative in the first few days. However, we recommend that you repeat the test 3 or more days after the symptoms begin. And you should always keep the patient in the suspect Ebola area until a sample is taken 3 days after symptoms begin. And if that sample is negative, then you can release the patient. If it's not, then of course you should keep the patient in the isolation. Just to remember as well that just because a patient tests negative doesn't mean that they have immunity. Sometimes there is a question of, can I use a rapid test instead of PCR? WHO actually recommends that, yes, you can use rapid tests when PCR tests are not available. However, if the rapid test is positive, you should always confirm it with a PCR test, simply because sometimes these rapid tests are not as good as the PCR test. In terms of specimen collection, it's best to take the whole blood from the live patient. If not, you can also take an oral fluid specimen if blood is not possible. But please note that all of these blood and body fluid samples are highly, highly infectious. If you want to collect and then transport it, you must use the triple packaging system. As well as in the lab, it must be done under safe conditions and maximum biocontainment conditions. So moving on to contact management. What do you do if you know of someone who has been exposed? So if you or someone that you know has been exposed, they should immediately clean the area with soap and water. Definitely call a healthcare provider straight away. And again, just to remind you, there is no vaccine for the Sudan virus. These contacts should be monitored daily for 21 days for any Ebola symptoms, and the 21 days will start from the last day that they were exposed. The contacts should be reminded of what the signs and symptoms so that they're aware, and they should not travel until cleared by health officials. And please follow all local guidance in terms of contact tracing and contact management. Okay, let's move on to the last part, which is about clinical management. So unfortunately, for clinical management of Sudan strain, it is predominantly supportive. There is no directed, targeted treatment for the virus right now. Some things that you should take note of is that you want to aggressively replace volume loss. You should give them oral hydration with ORS, even if they haven't started vomiting or diarrhea. You want to give them IV resuscitation with ringus lactate if needed, replace potassium and magnesium loss, and this is likely going to be a lot for patients with diarrhea. And again, there is no approved specific therapy, especially for the Sudan virus. Here are some things that you can do to treat some of the usual signs and symptoms of EVD in terms of management of fever and pain, nausea and vomiting, diarrhea, dyspepsia, being agitated. You should treat for malaria if it comes up. Or you can also empirically treat for malaria, and then you can stop the treatment when the results come back as negative. And you can also treat for any bacterial co-infections as well. So WHO has a lot of information in their guidelines, and the information covers things like how do you assess patients, fluid resuscitation, electrolyte monitoring and correction, glucose monitoring and correction, treatment of potential co-infection, nutrition, care for complication, management of complication. But I just wanted to alert all of you that the most important thing is to figure out, if you have a suspect case, where to transfer the patients to. Should they be sent to a local healthcare facility that can give them better care? Should they be medically evacuated out of the location, out of the country? So that's the main priority. You need to think about where you might transfer the patient to a location where they can receive much better tertiary care. So again, WHO talks about the need for close monitoring of such patients. You need to identify patients that has high risk of complications and treat them as if critically ill so that you can prevent them from further deterioration. WHO also has a daily assessment checklist here that you can use. Fluid resuscitation, again, is very important. You can give oral rehydration to patients who can drink, IV administration for those who cannot drink. Electrolyte monitoring is very important. You need to look at the labs daily and make sure that you correct all electrolyte abnormality. Low glucose is often seen, and so again, you should monitor their serum glucose often and give them IV glucose if needed. Again, bacterial co-infections can occur as well as malaria, so you might want to treat empirically, means treating them early, even before diagnosis, for such conditions. The nutrition is very, very important, so they should have proper nutrition to prevent further complication. Feeding, early nutrition is important. Stress ulcer prevention is important as well. And mobility is important as well. Make sure that they are encouraged to mobilize well to prevent complications. And so these are all the sort of complications that can occur from Ebola. Again, we are outlining for you all the important and top UN, WHO, and CDC EVD resources that you can see over here and take a look at. If you have any questions for us, please contact us from the UN Health Services over here, and we can help answer any questions related to this presentation. Thank you very much.